It's impossible to say people must all stay at home. It's also impossible to say the children mustn't go to school. It's impossible to say there must be no economic activity. It's impossible to say continue the lockdown forever. It is not possible. And this we have found to be a major issue on our side, because we want to make sure that whilst you prevent the spread of the infection, you also want to make sure that people do not end up with a problem of hunger, lack of income, and economy that's going to collapse. So to balance that up, we've then been saying, President said we must have a risk-adjusted return to normality, which is what we're trying to do.
All right, Kaya, now we have the national picture, and let's focus again. I know you mentioned it earlier about Mpumalanga. The minister went there to assess the situation and how it was handled. What's he saying?
Well, Shahan, I can tell you that much. So with the reopening of schools, so it's one area of concerns among so many parents in South Africa. But the minister emphasized that we can't be under lockdown forever. We know that COVID-19 may be here for a year, for 2 years. And he spoke about how they really took the Department of Basic Education to task in terms of its own proposals and making sure that finally they reached a logical conclusion, but making sure that they do observe the hotspots, the areas where the pupils might be affected. So they will continue to monitor the trends, but also, more importantly, speaking about the issue of making sure that all the public servants are given the protective gear, making sure that the sanitization as well is another area that they continue to improve on. So he said for some time they really procured a very sufficient amount of PPE in terms of the protective gear that is very key for the teachers and many other staff in our facilities as well. So once again, let's hear the minister really assuring the nation in saying that he does understand all types of anxieties that people do have.
We do wish to convey our condolences to the family and relatives. We also want to say thank you to the staff that had looked after the individual. What actually in this case happened was that the individual we did not report immediately, because I've been very strict that we should, by the time we announce, have a clear explanation, particularly the results. So a patient was admitted with a differential diagnosis, which means a suspicion that they would have been having COVID-19, and the doctors went to treat on that basis. In the process, they took some tests, and then by the time the patient had passed, the test had not been received. So when they were trying to put all of that information together, we then said that they shouldn't put the name on the statistics, because I want us to be sure that it's not something that once we have done, we're going to retract.